Lyons-Appiah. I'm here with the International Forum for Quality and Safety in Healthcare, and I'm here with Jason Leitch. Jason, do you want to introduce yourself?
Yeah, so I'm Jason Leitch. I'm Scotland's National Clinical Director for the next 2.5 weeks. So looking for a new job. I'm spending a lot of time with the Caribbean delegation to see if they'll offer me something. It hasn't happened so far. the guy from Aruba, who I think surely there must be a job there at least for a few weeks anyway. So, and I'm about to give the closing keynote of the forum, just in the room next door, if anybody stays, if they haven't all left.
Mm-hmm. Okay, so if we're thinking to go back in time, I want to find out a bit about your journey. So if you could go back in time and give your 20-year-old self a piece of advice, what would you say to him?
So that would just be a couple of years back. It wouldn't be long. So I think that journey is not predictable, and that's what everybody says, isn't it? That you strive in that moment, and you spend a lot of time when I was in my 20s thinking about what the next thing might be. And I've probably had 3 phases of my career. I trained as a clinician, so I was a dentist, and then I did oral surgery, which is this part of the body, of course, and I did fixing people's broken jaws and all of that. I'm not going to actually hit you. It was a demonstration. And then I became an academic, and I started to do the university side of that world. And then I went to the States, and I worked for the organisation who, along with the British Medical Journal, run this event, the Institute for Healthcare Improvement. And it opened my eyes to this new world of safety and quality, of systems design. And since then, I've worked for government. So I've been trying to take what we learn here into practice in a country, a small country, perfectly formed, of 5.4 million people in Scotland. And we've tried to take some of the lessons we've learned here, and now I'm transitioning again. I don't know what to a 4th version of whatever this is in the next phase.
But looking after a country, it's a massive job, and how do you feel like you're able to translate what you're kind of learning on the ground back to government and making sure that they understand what's going on and they can implement some of that stuff?
So nobody can do that by themselves, of course, and all of these things are coalitions. And one of the lessons from here is that you need to bring together all of those different groups of people. Politicians, you might have to talk to them. I mean, it's a terrifying thought. The civil service, the health system, but also the patients, families and carers who we serve. And I think I've learned over time that the more time you can spend with and this is maybe not the right phrase, but the customer, those who you serve, the better your system will be. Now, I've also got political leaders who are working on how to spend the money, on what policy to prioritise, because we're in the same bundle with education, with justice, with building bridges, so you have to be in that game as well. And I think in Scotland we've managed to create an environment of quality and safety that has actually had proper results in people's lives. So it has transformed the way we deliver, certainly frontline healthcare for safety, for example, over the last 10 years.
Do you have any specific stories of how you've seen the process of co-production and involving all of those different people, those different stakeholders, and creating something that you can clearly see everyone's input in?
Yeah, I think my 2 neatest examples are one is quite microsystem, and one is a decision that we made as a country. So the microsystem one is the What Matters to You movement. And there's been quite a lot of chat about this here. Started in Scotland and Norway, and What Matters to You is the simplest thing in the world. It's a moment in the healthcare conversation where you ask the patient and the family what matters to them. It seems like a revolutionary idea rather than ask
Obvious.
them. It's crazy that we don't do it. And it's spread now to, my wife's a teacher. She does it in her school class. We do it in primary care, we do it in social care. And when you ask people what matters to them, they don't say chemotherapy. They say yogurt for dinner, my grandfather, my football team, my cricket team, whatever it might be. So it changes the dialogue. So I think that's been crucial. The more structural thing we've done is we bought a thing called Care Opinion. Care Opinion is a not-for-profit charity. I promise I've no money in them. You can go and look them up yourselves. They're not very expensive. What they are, in summary, is an open source TripAdvisor for health and care. So you, let's say that you're the patient, you come to my clinic and you and I have a consultation, and I will give you, at the end of it, I'll give you a little business card with the Care Opinion website on it. And you go in and you say, this hotel was too hot, too cold, it's just that. You say, the consultation was on time, he was charming, he gave me everything I wanted. Or it was terrible. I waited for 4 hours, couldn't see him, he was rude, he drank his coffee, didn't look at me. Or it could be the whole experience of social care. We've now got 80,000 stories on that website open that you can read, I can read.
And so, literally TripAdvisor.
TripAdvisor for healthcare.
Yeah.
But the key change is that it's a dialogue. So it's not just a complaint. So you don't send it in and don't get a reply. The nurses, the doctors, the physiotherapists, they answer.
And you see all those replies as, going
live,
through the website.
Live.
Yeah.
So if you complain or you praise, I will go on and say, thank you very much. Here's what we think you should do. Or if it's a really bad complaint, I'll say, right, phone me and we'll do something. The really intriguing thing is we are used to getting complaints from patients and families, of course. And that's a big folder. In Care Opinion, 70% of the stories are 100% positive.
That's amazing.
So you get this real balance of, you still get the misery, of course.
Yeah, of course.
But you get this 70% of joy for staff who get encouraged and hopeful.
And then they end up doing a better job.
Of course. So I think it's the single most important thing we've done for person-centred care across the system in Scotland.
Brilliant. So we're at an international conference. Do you want to share some of the learnings you've taken from the other delegates who are here from all across the world? Yeah,
so I spent a bit of time over the last few days. At one point I was at a table that was weird, because I'm Scotland sitting in a chair, and over here is Nigeria, and here is Aruba, and here is England, and here is Canada. And it was a discussion around politics and health. And it turned out that when I described the Scottish challenges, they all nodded. It was the same. There's money challenges, political challenges, infrastructure challenges, the demographic challenge. And the solutions were in all of us. None of us had the whole thing. But most of the problems had been solved in one place or the other. And I think that's why convening is so important. Bringing people together in one place to talk about it, I think, is crucial. And it's one of the things that digital can't do as well as we would like.
Having these outside of COVID is just brilliant.
People talking to each other. So I meet new people, they meet me. Now, some of those will move on. I took a photograph earlier today of two people who I know who didn't know each other.
Oh, so you've yes.
And you can almost see the magic happen. Because I know these two people are concerned about children's health independently. And they don't have the whole answer, but I know he has some of the answer and she has some of the answer. So maybe you buy them a cup of tea and something sparks. And I think that's what's crucial about here, that most of the problems we're facing have been solved in part by somebody. And it may be Nigeria, and they might need to come and help us, or it might be Scotland, and Scotland could help somebody else. So that's what I think is my key learning.
Okay, brilliant. My last question is, I want to think kind of future forward thinking. What is one practice that you're seeing in healthcare in terms of quality and safety that you wish will be outdated in the next 20, 30 years? That you're like, I don't want to see that again.
Well, this is really pretty much out there, but am I hopeful enough to say this? I hope we don't have to keep talking about climate. I hope we've solved climate. Now, that feels too hard, doesn't it? But if you told me 20 years ago that we would not be talking about infection at this conference, I wouldn't have believed you. So we used to talk about infection every year. People would put up graphs of the number of people who had been harmed by infection in the hospitals and the number of people who had Staph aureus. There's none of that now, because we've fixed it. Could we? Could the young generation, pointing at you rather than me, could they actually help us solve at least healthcare's contribution to the climate catastrophe? Clearly there are other issues there about transportation and air travel and oil and gas and all. I understand that, but the healthcare contribution, which we estimate to be 5% of carbon in the world, could we over the next decade actually fix the healthcare contribution to climate? Wouldn't that be marvelous?
And like you're saying, there's so many amazing people out there, activists, different people that can convene and have these discussions, and hopefully we can see a bright future. So you can interview me again in 20 years when I'm very old, and we'll see if the next generation, apart from me, has managed to do that. Thank you so much.
Thank you for having me.